Does a fever cause brain damage? And what temperature is a fever anyway? And is fever an illness in and of itself? And can you tell whether you have a viral or bacterial illness based on your fever? I'm going to answer these questions and more, guys. It's good to see you. I'm Dr. Jen Caudle, practicing family physician. All right, let's jump into the one that you might be worried about. This is a widely held myth, by the way, and that is the idea that a fever causes brain damage. Now, thank goodness it doesn't. And yeah, it does not cause brain damage. So I can take that, lift that right off your shoulders. You do not need to carry that around. That is good news. Now, let's go on to kind of what we use to define a fever, right? So a fever is generally defined as a temperature of 100.4 degrees Fahrenheit and higher, all right? Maybe if you're a kid, depending on how the temperature is taken, the number might be a little different. Talk to your child's pediatrician, but 100.4 degrees and higher is generally what we use. Now, what is a fever, you might be asking? Or let's start with the question, is it an illness? Fever is not an illness in and of itself. It's actually a side effect or a result of, say, an illness or other things. That's right. So let's actually start with the other things and illness part, and then I'm going to go back to more of what a fever is. We often think about getting a fever when we're sick. We have some sort of infection going on. And it is true that, yeah, probably most fevers happen as a result of infection, but not all of them do. You can actually get fever for other reasons. You can actually get a fever due to certain medications you're taking. You can actually get a fever because of certain underlying conditions, like if you have cancer or if you have an autoimmune disease. And along those lines, right, we said that probably most fevers happen as a result of infection. Some people think that, hey, if their fever is a certain level, it's more likely viral than bacterial. You might be wondering, is that true or not? Well, that answer is no. You can't tell whether you have a viral or bacterial infection. By the way, there are other infections too, parasitic, etc., fungal, right? You can't tell what type of infection you have based on the number of the fever that you have. Okay, so yeah, that's straight. Going back to what a fever is not an illness, it's a side effect, it's a symptom, it's a result of, it's a consequence of, it's basically a reaction to certain processes that are happening in your body. In the case of an illness, it's a response to infection, okay? And there's all sorts of molecules and things that start getting all worked up when they see that we're infected and they try to fight it off. And fever can be one of the things that happens in that process. But fever, as I mentioned before, can also be a result of something else going on in your body, whether it's inflammation or something else, some underlying condition, right? So think of a fever as like a reaction to, a result of. And so I hope this is helpful. I have other videos on fevers, so make sure you check those out. Let me know what you think about this video in the comments. I'm Dr. Jen Caudle, practicing family physician, on-air health expert and video creator. I do daily videos, literally on everything. Please like and follow my page on Facebook. I'm on Instagram, TikTok, LinkedIn, WhatsApp. Please subscribe to my channel on YouTube. Sign up for my free health newsletter at drjencaudle.com.